All
I'm
right.
ready.
Excellent. Thanks for joining. We're here with Dr. Jon and Dr. Jon Wells from Infinite Regeneration. And we're here with a few members of our group to ask some questions just to get to know the practice better, get to know you as a person. So, Charisma, you're going to ask a couple questions for Dr. Jon.
Hi, Dr. Wells. Can you tell me a little bit more about the stem cells, how it's collected, and the safety aspect of it?
Yes, I can. There's three variations on collecting stem cells. There's collecting stem cells from yourself. A lot of time that's done through a ileum punch or bone marrow punch. There's also where you can collect stem cells from yourself via fat. The new and hot model now is collecting stem cells from mothers who have donated their tissue at birth. For science, typically the best stem cell collection is out of the umbilical cord area. In fact, the umbilical cord, as we all know, has an artery and vein that's connected between the mother and the baby. It has a housing around it that keeps that safe from getting kinked and irritated. That housing has a jelly that keeps everything soft and supple. That jelly's collected. It's called Wharton's jelly. It's very high in stem cells and stem cell allografts. That is collected. It is minimally manipulated, or almost hardly any, according to FDA guidelines, flash frozen, and then that is collected in varying strengths based on what a patient may need. Safe as could be. Safety-wise, there hasn't been one rejection recorded in over 500,000 patients in the United States in the last couple of years with stem cells. The stem cells don't have the markers in them enough to be able to cause rejection, so your body typically absorbs those, and away you go regenerating.
Thus the name, Infinite Regeneration, right?
Yes, for sure.
I know that you mentioned all different types of stem cells. What is the effectiveness of using the umbilical cord?
Well, in our research, the umbilical cord typically takes one application, based on your level of generation. Typically, if we're going to talk knee, which seems to be the most prevalent, and or hip, it's a single injection, varying amounts of stem cells based on the size of your hip or your knee and or your joint that you're concerned with, and then how much degeneration is in that joint. So effectiveness-wise, we find the umbilical tissue is a one injection procedure. There's up to 3 injections for a similar level of degeneration in a knee if you go and pull your own stem cells out of your ilium, your hip. And then it's a painful procedure. It can take up to a year to heal that punch. I've had patients who went through that. The effectiveness can be quite effective, but a lot more painful and a lot more expensive.
Well, thank you. I'll turn it over to Lee, who has some questions for you in regards to the patient's perspective.
All right, thank you.
Yeah.
Well, hi, Dr. Jon. How are you today?
I'm doing awesome.
Oh, good, good. So my question to you is, I'm a new patient and I'm coming to see you for the first time. What can I expect?
Pre-COVID, we could set you right up in the office and or into a lecture series that we've been doing for several years here in the Central Coast and in the outskirts of LA or Thousand Oaks. In today's market, we'll still do a direct to office where we can come down and do a consultation with you, either have you bring your x-rays and or we can order you x-rays and set you up an appointment. Of course, the offices are all sterilized and super safe based off of the guidelines that all us medical people are still open have been using. We're going to be coming at patients now via a Zoom and or a FaceTime chat. We can do that over the phone if we need to with a computer. Those models work. I think one seems to work a little bit better because at that point we can sit down and work over your individual needs. I can review your x-rays with you and kind of tell you where you're sitting. So if we have your reports, I can go over that also. But if I have you in office, I can actually look at your x-rays and go over them with you and teach you about what is actually happening to your joints or your spine.
Oh, that's great. That's good to know. I had another question that just totally left me, so I'm going to leave it there for now.
We're going to be doing a whole series, so that's totally fine. And Jon, it's great getting to know you. And I know from some of the longer recordings we've done, you got a great approach, and it's very holistic, very mindful of the whole person. So it's been great getting to know you. And I would just say, everyone can stay tuned for, there's some virtual seminar type events coming out. Obviously you mentioned there's text-based interaction. You can set up a Zoom, a lot of different ways. Everyone, is trying to be flexible right now with how communication happens in this day and age. So it's been great getting to know you. Excited to have a lot of content out there for the public to learn more. And we'll talk again real soon. So thanks, Jon.
Yeah. Thank you very much. I'm super excited about helping everybody.
Right on. Talk to you soon.
Thank you.
All right. See you guys later.